number 19, right? Okay, let's move on page number 19. And I left another page. As soon as I finish this, I'm going to move into other section. Arthritis. Underline the word arthritis. On page number 19. When your patient has arthritis, means they have a lot of pain, right? Arthritis is pain. And what happens when you are in pain? You don't want to move. Are we clear? So what do? Underline the word mobility. Now they didn't give you the word range of motion, but they're saying mobility. What do you increase? Mobility. Let them move around. Let them do the work. Mobility means mobile. Now what happened? I'm having pain and I'm not moving my hand. What will happen? You're not mobile. What do you increase? They didn't give you simple word exercise. Write down the word exercise. Increasing mobility. What is increasing mobility? Range of motion. What are we doing here? Range of motion, mobility. Underline that. Cause stress to the joint, like jumping, hopping, high impact exercise or activities avoided. Remember, when you have a question, patient, write down on the top, rheumatoid arthritis. And they're saying acute word, and they're saying severe pain, and they're saying excavation. See, sometimes we think we did a good question, but you didn't read good. What do you increase? Here is here. Now don't give range of motion, but don't stop exercise. So if your patient has a lot of pain, severe pain, excavation, the disease is flaring up, what exercise? Write down the word isometric. Don't give range of motion. But you don't want patient to lay down and not to move around. Are we clear? So what is isometric exercise? You contract large muscle. You are not moving. What is range of motion? You are giving exercise like this. But if somebody is in pain, don't pick up your answer, tell them not to exercise, give pain medication. What exercise do you give? Contraction and relaxation of your large muscle. And the word they use in exam, isometric. This is a very important word when your patient is in pain, when your patient had fracture, your patient has cast, patient has traction. Always you encourage patient to do because they cannot move around. What exercise you give them? Isometric. Everyone is okay? What is isometric exercise? Is you are contracting and relaxing the large muscle. Contraction, relaxation of your large muscle. But you do want patient to increase mobility when they have arthritis. But if they're in severe pain, then what do you do in severe pain? What exercise you will go? Isometric. I want you to write down the word a splint. They can use the splint in rheumatoid arthritis, in adult, in children. And what is rheumatoid arthritis? Systemic. It's a lot of pain. And they cannot move. So what do? They use splint, and your answer would be to reduce inflammation and pain. So if they give you, your patient has inflammation and pain. Your patient has, or child has rheumatoid, severe arthritis, systemic, and they are having a lot of pain. What is the answer you will pick? Either they have isometric or splint. Are we clear? What is splints are? You put their hand and they are supporting them. If you go and see patients, they're using a splint for elbow and for hands, for leg. So you are supporting them to reduce pain, but you also, if what happened, a lot of patients, when they lay like this, they become contracted. So we use splint to prevent. So splint can be used for pain, reducing pain, inflammation, and contractures. Now what is contractures are? When you have gone in nursing home and you have seen patients are like that. Are we clear? Because they are not moving around. Your job is to prevent contracture and the pain. Are we okay? So rheumatoid arthritis, what do you do for your patient here? Is mobility. But if you let them do range of motion, but when they are in a severe pain, then don't say stop. You continue isometric exercise. Are we okay? All right, next. Severe malnutrition. Malnutrition means they're not eating. Their body is weak. Underline the word lack of calories, especially protein, and low serum albumin. Albumin is a protein. So write down the word albumin is what? A protein. So when you're malnourished, what your body needs? Protein. And what do you increase? Continue albumin as a protein. So what do you give malnourished patient? Increase protein. Are we clear? So that is, underline that word. Asthmatic patients are having respiratory status. And if they give you, your patient has evaluate. How do you evaluate breathing or asthmatic patients? Or underline the word peak flow. That is important and comes in a lot of time in your question. What is peak flow meter? Peak flow meter, and you are using for breathing problem. Asthmatic patient, anywhere breathing problem, peak flow meter. What is a peak flow meter? I want you guys to underline the word second line. Peak flow is in the end of the first line, measure expired air. What is measuring? Expired. What is expired? Remember, inspiration and expiration. Inspiration, you're breathing in. This is breathing out. Are we clear? So what are you measuring with peak flow? Write down, highlight the word expired air. What are you monitoring? Expired. How much are they taking out? Expired air. So where it says expired air, highlight like this. Highlight peak flow meter. We all should know peak flow meter. What are we checking here? Expired air. Is peak flow, it tracks their frequent and regularly. Underline the word peak flow meter 80 to 100 is of person best normal, is peak flow meter 80 to 100 of person best. Normal 70 to 50 and beginning 79 to 50 beginning to have excavation. So when they're going 79 to 50, that is excavation. Remember the word excavation means they're getting really sick. They're bad. They're acute excavation. So which is the good one here? 80 to 100. 80 to 100 is normal. If your patient peak flow 79 to 50 are, that means they are not good, is beginning to have excavation. Less than 50, if it is less than 50, that's worse. And what does it mean? Underline the word, is bronchoconstriction. Bronchoconstriction means your lungs, bronchioles are constricting. That's not good. Are we clear? When you see the word bronchoconstriction, they're not able to breathe out. Are we okay? So what is a question? I think it came a couple of times. So it is good that you guys know what is your measuring in peak flow meter, your expired air. What is normal is 80 to 100 is good. As your patient is going 79 is lower than 80 and 50. Below 50 is worse. Are we clear? That means is causing, what is it causing? Bronchoconstriction. That means in the lung. See, you have to read a couple of times and you're going to memorize. So don't get nervous. You got to learn. And we got to learn is you're using in asthmatic patient. Next is fluid shift may drop blood pressure. Now fluid shifting is right down on the top in burn patient. In burn patient, fluid shifting means write down fluid hypovolemia. Now, hypovolemia, either you're losing from body or your fluid. Instead of the blood vessel, it's going in the tissue. Are we clear? That's called fluid shifting. Which patient do you have fluid shifting? In burn patient. And what is fluid shifting is, I want you guys to write down, the fluid is shifting from intravascular. Intravascular is a blood vessel and it's moving into interstitial. So when they give you the word in burn patient, what happened from the blood vessel? We have fluid. That fluid, instead, you're not losing in urine, but where is it losing? It's moving towards the tissue. So we call fluid shifting. Whenever there is a question, fluid shifting, what do you monitor? Hypovolemia, dehydration. Write down the word dehydration. Okay? And what is hypovolemia means? Shock. Write down the word shock. So it says drop the blood pressure. They're going in shock. Rapid pulse rate and check the BP because they're dropping the blood pressure. Everyone is okay? What is fluid shifting means? Dehydration. What is in dehydration? Shock. Are we clear? Hypovolemia is a shock, not hypervolemia. Hypovolemia. Next, I will move on to the next page. Anemia. Underline the word anemia. Iron deficiency. When you have iron deficiency, you give them iron. Your organ meat. Meat is a good source of iron. And macrocytic, microcytic, and pernicious anemia. Pernicious anemia, so iron deficiency anemia, you got to give iron. Pernicious anemia, you need to give B12. Hemolytic anemia, you need to give blood. Are we clear? So there are 3 types of anemia. Next is exposure to radiation. Write down on the top, internal radiation. Time plus distance. Write down only 30 minutes in your shift or 30 minutes in a day. Visitor, no longer that. And distance from your patient, stay away 6 feet. If your patient, and write down what isolation, write down the word strict isolation. It's called strict isolation. Are you closing the door? Yes, close the door. Make sure, write down that. If you have internal radiation patient and they have implanted in the body, then what do? You put them in the room and close the door and stay away 6 feet and 30 minutes the distance. Next is, we talked about the crutches and assistive devices. Everyone remember the word for your patient, prevent complication and assist your patient with assistive devices. Whenever they're saying patient, what is assistive devices? When you cannot feed, a special spoon. Are we clear? A special cup, assistive devices. When you cannot walk, you are using cane. You are using walker. You are using crutches. So these are assistive devices. A patient who had a stroke, they're using a special spoon. Are we clear? Special plate. Special thing to change their clothes. Are we clear? So that is called assistive. You are assisting a patient by using assistive devices. Are we clear? So that is the right wording for you guys are. Now, when you're using walker, go up with good leg, down with the bad leg. Upstairs, good leg first, and down stair, the weak leg, and then using cane and crutches and walker. So we all should know the cane, the crutches, and the walker is very important that you guys are using the crutches and the cane and the walker. Are we okay? And so we must know that those are important for us, for your patient in assistive devices. Next is high protein diet. What is in high protein diet? Underline, interfere with absorption of Sinemet. So when you're giving Sinemet, what is Sinemet is? A drug you're giving for what? Parkinson. Are we clear? And what do you give them is cut down the food with high protein because it reduces the absorption. What do you monitor when you're giving Sinemet? I want you to remember your Parkinson medication, monitor for low blood pressure. They drop the blood pressure. And all your Parkinson medication, I want you to write down no B6. It lowered the absorption. So I'm on Parkinson. Sinemet is a Parkinson. Let me remind you guys. Lot of Parkinson drugs are coming in exam. Parkinson, Alzheimer, very high in NCLEX, okay? So Sinemet, all your Parkinson medication, you must check the blood pressure. And what do you not give them? B6. And B6 is why? Because it reduces absorption of the medication. So remember, no MAUI also with your Parkinson medication. What is MAUI is depression medication. So don't give them with them because it doesn't affect their medication. Bone marrow, we already talked about it, emboli. Write down the word where it says emboli, fat embolism. We talked about it. Fat embolism comes from fracture, and write down there from bone marrow. And what does it lead to? Next line, I want you, some causes for bone, it comes from, so what is from fracture your patients are getting? Fat embolism. What is fat embolism is leading into, make sure you guys know, pulmonary embolism. If you don't treat them, then also it says it can lead to MI. And also, what do you monitor for your patient with pulmonary embolism? Shortness of breath is important. They may need oxygen, definitely. And also check ABC, airway, breathing, and circulation. So how do you get pulmonary embolism? How do we get pulmonary embolism? From fat embolism. Are we clear? What are you going to prevent your patient who fell in your question? They're not going to ask you what is fat embolism in exam. Your question is, your patient is walking, patient fell and patient had a fracture. And what do you monitor patient with fracture, fat embolism? So what do you do as a nurse? What do you do as a nurse? Don't let your patient move, immobilize. Are we clear? What do you do? Immobilize. The reason for immobilization is you are preventing for pulmonary embolism. Are we clear? So how do you get pulmonary embolism? From fat embolism. What are the other three things? I always remind you, pulmonary embolism comes from, number one is here, fracture. Number two is DVT, deep venous thrombosis, circulatory. This is in a fracture, in a bones. This is in a heart patient. Patient who's laying after surgery and patient has DVT. Are we clear? What is DVT? Deep venous thrombosis. Your clot is forming. And number three, air embolism. All these three things are leading you pulmonary embolism. Are we clear? So everyone is, what is fracture can lead to? Pulmonary embolism. You got to immobilize your patient. If you don't immobilize, your patient is going in pulmonary embolism, or second thing is MI. Are we clear? So that's important that you monitor your patient. We already talked a lot about pulmonary embolism. Next, I'm going to move on traction. What is traction? Is alignment. You are fixing the bone alignment. And pull. Underline the word pull. Traction means you are pulling the muscles. You are pull. What is traction is? Cast is different. When you put the weights, you put the traction. What is the tractions are doing? Is they are pulling the muscles and they are bringing. So it's a pull and you have a weight on the side. And underline the word must not rest on the floor or bed. Your weights should, write down the word on the top, hanging freely. So your patient is laying and your rope is coming and there are weights. And these weights should not touch the floor and should not touch the bed. Are we clear? Because what are you doing in traction? You are pulling the bones. And what are you immobilizing and you're relieving? It's not joining the bone, but is relieving the muscle spasm and pulling the bones. Are we clear? So that is tractions are called. Now, after hip replacement, very important, we already talked all of that in the first thing and also a lot of in your Spiderman package. But remember, flexion. What is flexion means? Bending of the leg. No more than 40 degree to 60 degree. So if they're saying, what is 90 degree? You're bending like this. And when you bend like this, the dislocation of hip. So what do you prevent your patient? Do not let them bend. So don't let them sit on a regular chair. If they're sitting in a regular chair, what will happen? They will bend the leg completely. So what do you prevent your patient with? Hip surgery patient, flexion no more than 40 to 65 degree. Never pick up 90. Also add their pillow between the leg. And what is the pillow doing between the leg? Abduction. Write down two words, flexion and abduction. What is abduction is you are using the pillow. Abduction, you are using the pillow between the leg. Are we clear? And that's important that we are using the pillow between the leg. Next is slight and moderate are usually normal. When they use word severe, it's not good. You must know thyroid. We already talked about endocrine system. Thyroid, you have two diseases. What are the two diseases in thyroid? Hypo and hyper. What is in hypo? What does hypo mean? What is hypo? What is the name of disease? Hypothyroid, mixed edema. Remember, hypo people are edema word. Are we clear? And they gain weight. So write down the word mixed edema. Hyper people have Graves' disease. So this is low and this is high. Graves' disease. Thyroid. Everyone write down what is your thyroid does. Your basal metabolic rate. What is the thyroid gland? Is producing thyroid hormone, and these thyroid hormones are responsible for basal metabolic rate. Very simple. When you are hypo, your metabolism is very low. So what are you are? Mixed edema. They gain weight. Graves, they lose weight. Are we clear? Everyone remember, you got to know your thyroid pack. Your question, teaching question, drug questions are going to be there. And because we have a lot of people with hypo, they are gaining weight, they have constipation, they are cold, their blood pressure is low, and pulse is low. Very important, they're cold people. Hyper, what is in Graves' disease? They have Graves' disease has diarrhea. They have constipation. They have diarrhea. And also remember, the blood pressure is high. The pulse is high. They are agitated, nervous. And they are irritable. They may complain tachycardia. These people are slow, physically and mentally. They're slow. Are we okay? So you must know good hypo. We have talked before. Hypo people, mixed edema, you're giving thyroid hormone. Write down like that, thyroid hormone. What is thyroid hormone? Synthroid. Synthroid, cytomol. What is hyper? Anti-thyroid medication. What is anti-thyroid medication? Are PTU, prothyrosil. You're giving prothyrosil. You are giving is here for your patient the medication, tapazole. These two drugs very important for your thyroid storm. Thyroid storm, they're turning more hyper. And they are very nervous. The blood pressure is high. And they have diarrhea. Everyone should know thyroid storm. Are we clear? Is a complication of thyroidectomy. You guys have, some of you have written before. Make sure we all know thyroid hormone, anti-thyroid medication. Next is I will go over TPN. We talked about TPN. And how do you give TPN? Central line, PICC line, next line. What is high? Sugar. TPN, what is high? Sugar. What do you monitor? Hyperglycemia. Myasthenia gravis, we did. Myasthenia gravis, lack of acetylcholine. What is lacking? Acetylcholine. And what medication do you give them on myasthenia gravis? And you monitor when you're giving drug, cholinergic crisis. You give medication tensilon and mastinin. Drugs for myasthenia gravis. What is the biggest problem in myasthenia gravis patients are? Breathing, respiratory. Write down the word respiratory. And they cannot keep their eyes open. They're closed. All their muscles are getting weaker. We have done, so make sure you guys know, either you're listening in a Spider-Man package or earlier pages. Myasthenia gravis, you must know. Multiple sclerosis is also your neuro chapter, muscle weakness, and they are more with the leg. Write down on multiple sclerosis is starting with the legs. Multiple sclerosis people are eye problem, diplopia, their eye movement. The legs are getting weak, and write down bowel and bladder. Multiple sclerosis is spasticity of the muscles. Safety is very important. Eyes, their eye care is important. Bladder, they cannot pee. Bowel, they cannot have problem in emptying the bowel. Constipation, urinary retention. Are we clear? So you guys make sure, whatever the word came here, I want you to understand more, not only knowing one line. Your questions are going to be, what do you do for your patient, okay? Halotraction on the other side lead to meningitis. Why? Infection. Where do we use halotraction? It says, write down skeletal traction, spinal cord injury. Then you will go on glomerular nephritis. What is glomerular nephritis? Is the kidney problem in the children. And lead to renal failure. How do you get glomerular nephritis? Streptococcal infection. Write down there, streptococcal infection. Crush injury can lead to compartment. Fractures lead to compartment syndrome. 5 P's, we already said, monitor. What is 5 P's? Write down on there, paresthesia, pulse, and write down neurovascular assessment. And we finished that. Now, page number 21 is your drugs. We have talked about the drugs. And page number 21, it tells you pharmacological. Your question are going to be an exam from 11 to 17% of your total question. Maybe 1, maybe 2, maybe 3. And Pril. Pril is your blood pressure medication, is called ACE inhibitor. What do you monitor for Pril? Cough. Write down the word cough. Side effect. Your patient is coughing. You need to notify. Oral. Beta blockers. What do you monitor for beta blockers before you give medication? Pulse rate, heart rate, not the blood pressure, pulse rate. Sartan is another blood pressure medication. Depine, calcium channel blocker. These all 4 of them are your blood pressure medication. Then you go into next one, myosin. Myosin is aminoglycosides. I did yesterday, your antibiotic. Antifungal medication, Enwardazole. Penicillin, saline. Cyclin, tetracycline. PAM is benzodiazepine. SNR, serotonin non-epinephrine reuptake. Zyed are your diuretics. Now, it gives you ending word. Now, it's up to you. Whatever you guys can memorize them and go over. Underneath, they are telling you about cholesterol drug, antihistamine medication, calcium channel blockers, psychotic medication, and immune medication. You have cyclosporine, we did in first package. Pain medication, methadone. HIV medication, Vir. All your ending word is Vir, are your HIV. Second box, you have antidote. I know you cannot memorize all of them, but you must know number 1, Tylenol. And S is mucomist, acetylcysteine is important to remember. They will not give an exam mucomist. You can have a lot of them, but then you have digoxin, you must know. Then you must know your heparin, your insulin, iron, lead, magnesium sulfate, which is in the bottom. Bottom is, you have bottom magnesium sulfate, go from the bottom and skip 2, then you have heparin and insulin, iron. So see what you can remember, common drugs. Are we clear? So those are antidote. You cannot take exam if you don't know your iron toxicity, your Tylenol toxicity, what are you going to give them? The next page is the last page, is also you have a lot of antidote. But at least you should know here is your opiate, which is number 4, is your naloxone. You can give them for opiate analgesic, is your when you're giving opiate, that's your antidote. So now I'm going to start the next pages I gave you guys, and I will continue till 1 o'clock, and then we'll take a break, and 1 to 2, and then 2 o'clock after we come back, we'll finish this. So there are self questions here, and it's good for you guys to remember, and I'm going to show you how. Everybody has this package, the one I gave you guys, and I will read through because I want you to be sure you know. Number 1, blood pressure, cough, I already told you. If it is narrow, your blood pressure goes up. Opposite, if it is big, your blood pressure goes down. Number 2, you've underlined the word insulin. Single insulin, if you're mixing up, which insulin do you draw first? Regular insulin. Are we clear? And also, when preparing single injection, who takes regular insulin and heparin, you draw regular insulin. You don't mix heparin and regular, but with regular, you mix with NPH. So underline the word NPH, which is in the last. Number 3 is ronchi. Ronchi is rumbling sound and on auscultation. Okay, they are more pronounced during expiration. So when do you hear ronchi? Underline the word expiration, when you're breathing out. Gavad is feeding. Underline the word feeding. Tube feeding. When you feed, we use the word gavaj. You're putting through the nose or the stomach feeding. Maslow theory, very important when you're looking in your question. You go physiological need, air, water, food, shelter, sex, activity, and comfort. Next line is safest, very important as a nurse, identify your patient and check their identification band on the wrist. So underline the word identification band. Before you give medication, before you do procedure, what do you check? ID band. You're going with the right patient. You got to recognize. Now, if they give you a question, patient has no ID band, what do you do? Call somebody. Don't say you will get a new band, because it will take a time. So you're giving a medication and you go in the room, there's no band. Call somebody who has been there and they know the patient. Are we clear? Recognize by person who can recognize that patient. Are we clear? That will be your best choice. Safest way, therapeutic environment. Very important for patient safety. In therapeutic environment, safety is important. Now, fluid oscillation means in a chest tube drainage system. Oscillation fluid means fluctuation. Oscillation means fluctuation in your question. Next line, segment 10, nurse should place segmental tube patient in what position? semifurous. Write down also when you have suction, NG tube suction. Any patient with suction, you put them in semifurous. If you have segment in Blackmore tube, your patient, what position? A lot of positioning are coming in exam. And where do we use this tubing? Segment in Blackmore. Write down esophageal bleeding in liver cirrhosis. So when your patient has liver cirrhosis and they are bleeding, and where are they bleeding? Here is esophageal bleeding. Esophageal bleeding. So which patient you have bleeding esophageal? Liver cirrhosis. And this tube helps to stop the bleeding. Are we clear? So why you're using this tube, segmented Blackmore tube, to stop the bleeding. Next is, what do you keep in the room when your patient has segmented tube? Scissor in emergency, because you have to remove right away. Trouser sign, and also trouser sign you're checking where? Hand and finger spasm, and write down the word carpopedal spasm. That's important. Carpopedal spasm, and you're checking for patient with tetany, and also write down the word low calcium. When your patient has low calcium, sign is what? Is you do trouser sign. Write down Chovastic sign. Also for same, Chovastic sign is on the face, facial, cranial nerve 5. Are we clear? You are assessing cranial nerve 5. So just highlight the word. These are good to review for your answering your questions. Are we clear? And so you can write down that. Then you go blood transfusion. You must know what size of needle you're going to go. 16 to 20 gauge. Highlight that. Next is intractable pain. What is intractable pain? Incapacitate the patient. Intractable patient cannot move and not relieved by the drugs. Intractable pain means you gave medication, patient cannot move around. Why? Because the drug is not helping the patient. In emergency, consent. How do you get consent? Is okay, fax, telephone, and telegram. Somebody cannot come. They can fax you, is okay in emergency. Only in emergency cases, all right? So patient is in emergency. Can you take a consent by telephone, fax, and telegram? Yes. In the next line, decibel is a unit for sound. So highlight the word for sound. Informed consent. Patient, treatment, make an X, and also to witness. Always good to get witness, maybe a doctor, maybe a nurse, two together. A patient who cannot write his name, and you have X and they are putting signature, you can have witness. Z-track injection, write down you give IM. And why do you give? Prevent skin irritation and staining. What is the needle size for that? Is 1 inch or longer. Very important. We all know IM injection. We all know how to give Z-track injection. In the event of fire question, very important you go raise. R means remove the patient. A means activate the alarm. When they are saying there's no patient, then you activate the alarm. Don't say call the phone, call fire department. No, activate the alarm. C means close the door. E means extinguisher. You will, because fire is very common in a hospital. They all want, we all should know fire and safety. Are we clear? So that's your answer. Next is RN. Is assigned license. Licensed practical nurse can be doing bedside care, suction, medication, and treatment. You guys can add treatment there. Very important, the next word. If your patient cannot void, means pee, what do you assess? Second line, bladder distension, and write down another word, urinary retention. So write down the next word. If patient cannot pee, they can go in what? Urinary retention. and write down PVC, post-voided post-voided specimen. So you're going to do urinary retention, and now write down if your patient has urinary retention, how do you check? Check post-voided, after patient voided. After 10 minutes, you put a straight catheter. And if patient has 50 to 100 cc urine, that means your patient is retaining. Are we clear? So when your patient is not peeing, what is the problem? They are retaining. And if your patient is retaining, and doctor said, check post-voided specimen. How do you check post-voided specimen? By putting a straight catheter. Are we clear? If your patient, so write down the word post-voided. After patient go to the bathroom, you put the catheter, and if it comes more than 100 ml or 50, that means your patient is voiding. So it has down, but write down word together. Next line, cane. Which side should be cane? Underline the word unaffected side. Where advanced, same time with affected. So when you have, which side is the cane? Unaffected. You move the cane with affected leg together. Are we clear? So move the cane and affected. That's your cane. When you are measuring the crutches, how do you measure? Underline next line, supine. Let your patient lay on the back. And then you go measure from axilla and to the sole and add 2 inches to measure. How do you assess your patient? When does your assessment start? Underline, when the nurse first encounter, when you see patient first time. We start assessment and continue until your patient is in the hospital. How do you assess your patient? Underline second line, health history. They brought their paper from the hospital. Doctor's examination, diagnostic test. So you talk to the patient. So they're saying, how can you assess your patient, and when do you assess? On admission, throughout, and how do you assess? You have there. Last line, insulin. Write down for insulin, appropriate size for insulin, 20 Fay, 5 gauge and 5/8 needle, and write down sub-Q. If they give you what is a sub-Q needle size, came in exam many times. So make sure you know the needle sizes. Some of you have written with my lecture I gave before, but whatever comes here, sub-Q, we give heparin, we give insulin. What is the gauge is 25 and 5/8 needle size. Residual urine. When your patient is after voiding is more than 50 to 100, write down that is called residual urine, and it can cause what word? Retention. They are retaining the urine. I will do a few more things. Let's next page. Standard nursing. What do we do standard care in a nursing? Center of Disease, CDC, is number 1, write down gloves on the top. We must wear the gloves. Some question they will say, what is CDC tells you? Use gloves. And second thing, do not recap your needle. Most needle stick result from needle recapping. We all should know, we do not recap the needle. You can get needle stick. IV push. By giving needle and syringe, or by catheter, by mixing in the fluid. See, IV push means is you're pushing IV, and write down give slowly. Don't push fast. Tracheostomy tube, next line. When changing a tie. Second line, leave the old tie, put the new tie first. In tracheostomy patient, when you're changing the tie, don't change it, leave old one, and then you put the new one and remove old one. Tracheostomy tube, changing, get assistant to answer. Either you get help or you leave the old tie and remove. Any answer can be correct answer for you. Are we clear? So assistance and this. Next is filter is used in blood transfusion. Some IV, they have filter. And so blood transfusion, when they're giving IV, they use the filter. The next is 4-point gait, means regular cane provided. Patient has underlined 4-point gait means is stability. Patient can put the weight, they're stable. Next line, good way to become patient interview. What makes you seek medical advice and help? So before you talk to the patient, you ask them why you came to the hospital. What's your problem, right? What did you feel? So ask them in the second page. And next is when caring a patient, follow standard precaution. What is your standard precaution are? Is use the gloves, gown, and mask. That's your standard. And write down another word for standard, universal precaution. What is your, see, these are the questions. You got to know simple, your foundation. And standard precaution, you wear the gloves when you're coming in contact. Potassium is, what is potassium is your ketone. And underline the word intracellular. There are fluid extracellular, intracellular. Potassium is intracellular fluid. 4-point gait. When you're going 4-point gait, remember, underline the word, you move in the first line end. You remove the right crutches. So you're moving the crutch. And then on the other side, you're moving left foot. That means 2. Are we clear? 1, 2. Then left crutches and right foot. These are 4 points. So you got to move one leg and one crutch. Are we clear? That's a 4-point crutches. So I'm telling you, you guys, we all need to know the crutches, cane, and this. These are very important. We are nurses. 3-point gait. What is in 3-point? These are all important. Put 2 crutches and you move affected leg. And write down 3-point crutches, you are putting non-weight bearing. Non-weight bearing when you have hip surgery patient. So you have hip surgery, you are going non-weight bearing. 2-point gait. 2-point means you move right leg and same time you move left leg. Then you move left leg and the right crutches. So everyone should know 2-point, 3-point, 4-point crutches going up and down. Next is, we talked about vitamin in first package, and B complex and water soluble vitamin are your B1, B2, B3, and B6 and B12. What is B12 cause? Pernicious anemia. Weight. When you're weighing your patient, is slightly dressed, maybe a patient hospital gown and no shoes. Same scale. Early morning is important. Temperature. If you're taking oral temperature, if your patient had smoke, hasn't smoked, is okay. Or consumed hot or cold water. If they are smoking hot and cold water, wait 15 minutes. Then you put the thermometer. So oral temperature. Nurse should not use rectal temperature. Very important, this one. Why? For cardiac disorder or bleeding disorder or hemorrhoids or undergoing rectal surgery. Don't take rectal temperature. Now why you are not doing the rectal temperature for cardiac? Let's go underneath and underline the word vagal response. And they dilate and decrease cardiac output. So write down vagal stimulation. Any question come, do not do vagal stimulation. Why? Because it lowers your blood pressure. Are we clear? Lower the cardiac, patient can die. And write down the word rectal. What are you removing? Impaction. When you're removing impaction, what do you stimulate rectal? Rectal area, your vagus nerve. And that's why you, in your exam question, patient has cardiac problem. Are you going to remove impaction? No. Are you going to do rectal exam? No. Why? Because you're stimulating the vagus nerve. And what can happen to your patient? They can die. They can go low blood pressure. The pulse is rhythm. What do you monitor in pulse? Rhythm. And also 3+ is bounding pulse. 2+ is normal. 1+ steady and or weak pulse and difficult to detect. O means absent. So 3+ is bounding. 2+ is good, more normal pulse. So it's your pulse assessment you guys have done, but they're giving an exam. You have pulse 3+, 2+, 1+, what does it mean? Are we clear? Now, intraoperative, your patient is going for surgery. Intraoperative means when your patient transferred to the operation room and until patient come back to post-anesthetic period. So patient leaves, patient goes for surgery, that's a not the pre, but intraoperative care. Morning of surgery, make sure you get consent, definitely sign from your patient. You do give shower. And last 2 lines, I want you to underline vital sign is important. Remove jewelry is important. Artificial limb, prosthesis should be removed. And what about the wedding ring? If somebody has a wedding ring, what do? If somebody says, I don't want to remove, put the tape. Only on wedding ring. Mostly all ring you remove, all jewelry, clean their nails. Are we clear? And patient is going for surgery, remove all artificial limb, anything. Comfort measure. Everyone, these are giving you hints. And I'm going over. Why? Because they're important. You read, sit by yourself. You may not understand where your question. Your patient is going for surgery, they have a wedding ring, you can tape it, otherwise you remove all. Comfort measure, positioning, write down back rub, environment. It increase for patient need for analgesic. Write down the word pain medication. Your patient is in pain. Don't say, I will call the doctor, pain medication. Give them comfort, give them back care, give the position before you call the doctor. Last line, and I will stop here, the trade name and the brand name for your medication and chemical and side effect of some drugs are important because you may see the question. So we'll stop here. 2 o'clock, I will go back on this and finish the taping. And if you are here, that's good. You guys have the pages. But I will finish, and next week I'll be here Wednesday.